Low Volt Galvanic, otherwise known as smooth wave galvanic or direct current, basic settings.
The next electrotherapy modality I'm going to show is the direct current, otherwise known as smooth wave. You can see right here that this has the spikes. This one has none, so this is called the smooth wave, or low volt galvanic. It is a galvanic treatment, and I'm going to go right to the edit screen. And what that means is that one of the two pads is going to have a negative or the negative ions, or it's the cathode. So the person's going to have the negative ions coming through one pad, and then through the other pad is going to be the positive ions. Now on the Chattanooga, again, plugging it into channel number 1 for my treatment. It doesn't matter, you just have to make sure you're setting it to channel 1. You can see here on the Chattanooga there's channel 1 set up, channel 2 set up. Right now we're setting up channel 1. The red tip on the wire is going to be the active lead. I've put a smaller pad onto the active lead and a bigger pad onto the dispersive lead. Now, yeah, the formula is this has to be 4 times bigger, so this is just barely big enough. If the person feels anything under the big pad, then the big pad isn't big enough. So sometimes I'll use pads that are really big. There's ones that you can use wet sponges, you don't have to use the adhesive, so it works pretty easily. I'm going to turn off this polarity reversal that's automatic, just to demonstrate something to you. Right now, if I use, I'm going to switch this also to polarity positive. That means from this little pad, let's say there's the shoulder problem, here's the dispersive thigh. This shoulder problem over here is going to be acute. Remember how you want your grades to be, AAA plus. What is that? Anode puts out an acid to treat acute problems with a positive ion, which means on the other side over here is going to be the cathode is going to put out a base, and it's good for treating chronic, and it's negative ions. All right, so the way we do this is a treatment for about 4 minutes, putting the pads where we need. You have to have 2 pads because you need to complete the circuit. Bring up the intensity, and you can see the intensity going up, and then hit the start. When you hit start on this one, it just starts the timer. At the end of the whole 4-minute treatment, I would want you to do then a polarity reversal. You bring it all the way down to 0. You'd switch the polarity to negative and maybe do it for 30 to 60 seconds. They say 60 seconds in most texts. And the reason is you don't want to leave acid or base in 2 parts of the body. You want to kind of neutralize it a bit before you send them home. Otherwise, they're going to end up on their skin with a nice big red mark. Now I'm going to show you how this one will max out at exactly the amount that you're allowed to max out. The formula for the maximum intensity of the low volt or DC treatment is 0.5 to 1 milliamps per inch squared of active pad. So anywhere from 2 to 4 milliamps is the maximum that you're allowed to have come through here. This is all patient dependent. If the patient says it hurts, you don't go that high. You go to where they feel it. There are some patients that feel a burning feeling at just as low as 0.4 milliamps. And other people, you bring it all the way up to 4 and they say, I don't even feel it. And I haven't figured out if it's because they're a sensitive person or a not sensitive person. We just know that everybody's a little bit different. All right, so that explains how to use the DC treatment.